A healthcare program meant to help Arkansans creates life-threatening problems for some families. Thanks for joining us tonight. I'm Jennifer Piñate. KNWA's Clarissa Bustamante is live in studio now with the issues some people are facing and the response from the organization in charge.
Jennifer, the provider-led Arkansas Shared Savings Entity, or PASSE program, aims to help Medicaid recipients who have behavioral health needs or developmental disabilities connect with health providers. But for one family, it's blocking their ability to get their daughter the medication she needs.
That was probably the worst moment of my life, realizing that, your child could pass away at any point in time,
Tiffany Nance is a mother of 7, one of those 7 being her daughter Josie, who was diagnosed with cerebral palsy. Josie had a 1% chance of survival when she was born and has relied on Medicaid her entire life to keep her going.
She has tube feedings throughout the day, and her lifeline is pretty much being tube fed.
But Nan says she's been having trouble getting tube formula through a new program under Medicaid. The provider-led Arkansas Shared Savings Entity, or PASSE program, was created to help Arkansans like her daughter Josie, who have developmental disability needs or complex behavioral health, connect with specialty providers and reduce cost of care. According to the Arkansas Department of Human Services, the need to create the PASSE program partially stemmed from the fact that nearly 3,000 people were on waiver wait lists for intellectual or developmental disabilities, accounting for $32 million in Medicaid costs for over 2,000 people. There are 3 different PASSE programs, each with a number of providers under them that can be found through its website. The one on your screen is for Arkansas Total Care, which is the PASSE program Nance's daughter is under. But she says her provider didn't even know they were part of the program.
I've been turning in her new PASSE card to the providers, and I even had one provider, tell me that looks like a dental card.
This has led her to not be able to bill her daughter's formula, which she says was previously approved by Medicaid, leading to her have to pay out of pocket or not receive it at all.
We've spent every last nickel and dime that we possibly could to provide her formula, and at $400+ a month, it's just not feasible with 7 kids.
After reaching out to DHS, Marcy Manley says in a statement that PASSE members should never have out-of-pocket costs for covered services. She also says services that people got before the program should continue to be covered.
We don't have formula at all. We've been having to give baby food pouches through her tube, which nowhere meet her caloric intake.
Nan says after reaching out to her PASSE coordinator and her provider about the issue, they assured her they would fix the billing problem and send her more formula. But she says it's past the deadline of when it was promised. On May 1st, members of PASSE can opt to switch to a different program if they choose to do so. If you are a PASSE member and you're having trouble accessing services or connecting to your provider, head to our website. That's nwahomepage.com. There we have a number you can call so DHS can help fix the issue. And if you're a provider and need help navigating the PASSE system, we have a different number posted so you can call for assistance. Live in studio, Clarissa Bustamante, KNWA Northwest Arkansas News.